And infant mortality rates here in the state are alarming and disturbing. In this Closing the Gap segment, the state health officer of the Mississippi State Department of Health talks about how they are working to combat this problem thanks to a free statewide program. It's called Healthy Moms, Healthy Babies. Tell me about the Healthy Moms, Healthy Babies program.
Our Healthy Moms, Healthy Babies program is an evidence-based home nurse visitation program for high-risk Medicaid moms and their babies if their babies wind up being high risk. And this is a program where every healthy mom that's referred to is assigned a nurse who will manage her case, will help navigate her case, make sure she's helped through the system, that she has the resources that she needs as she's moving through her pregnancy, and that mom will have a good understanding of the challenges that she's facing and help, and not just navigate, but bring solutions to bear to help her survive her pregnancy. So we're looking at the social determinants of health that are causing Medicaid moms to die at a rate 4 times that of our Caucasian population, and that we bring solutions, that we're not just watching and monitoring, that we are intervening. And the evidence is very clear that that will help reduce maternal death.
Speaking of maternal death, tell me about the infant mortality rate and the maternal mortality rate here in the state, and where do we rank?
We rank last, and we had been seeing a trendward down with infant death until 2021. We had a spike, and I think that's related to the challenges that the pandemic was bringing. But we now definitely lead the nation in both maternal death and infant death, meaning that women in Mississippi die at a higher rate than anywhere else in the country because they were pregnant. These aren't pregnant women that are killed in a car wreck. These are women who are dying because the pregnancy led to their death.
And do you find this issue in more rural and underserved communities?
We do. The highest number of deaths occur in the Mississippi Delta, but we do see a significant amount in central Mississippi. I think some of that may be because high-risk moms are being referred in for delivery and postpartum care. And then we see a significant number in northeast Mississippi, which I think is more impoverished white population.
And that's why this program is so important. Talk about that.
So having the ability to provide a resource, not just for the mom, but for her family and for her doctor. We've been serving moms in the program for about 2 years. It's steadily growing and becoming more robust, but we're trying to put our attention in the areas of the state where there's the most impact, but we serve the entire state. So it doesn't matter where you are. If you're a mom on Medicaid and you're high risk, and your doctor will screen you to determine if you're high risk, then you qualify for the program, and you can call us directly, or your physician can refer to us. But we have stories of women with diabetes, that gestational diabetes, being pregnancy is what activated the diabetes, and being able to bring their blood sugars under control under the direction of their doctor, but helping her understand that the foods that she's eating that's making her sick, and the foods that she needs, helping her get the food that she needs, giving her that education has been so powerful, helping women understand what makes you high risk, and how never to be at risk of dying again just because you were pregnant. Simple things like knowing your numbers, knowing if you have high blood pressure or high blood sugar before you get pregnant. Folks don't know unless you teach them.
And this program is free. Talk about that.
It is. It's a partnership between the health department and the Division of Medicaid. So it costs the moms nothing, it costs the physicians nothing.
How many people are a part of the program right now?
We are approaching about 1,000. I mean, it's growing, so it's north of 800 and growing. And we want as many as need us, to sign up. So it requires being a Medicaid recipient and being deemed to be high risk.
And if they need more information about the program?
Go to our website at healthymississippi.gov, and the Healthy Moms, Healthy Babies program is there with all the contact information. Mention it to your doctor at your next doctor's visit. And for community partners who want to be involved in helping to spread the word on what we need to do to reduce maternal infant death, reach out directly to us. I firmly believe, and I think the vast majority of us in Mississippi firmly believe, that every pregnant woman in Mississippi deserves the same chance of having a healthy baby.